Welcome to You Are Not a Frog, the podcast for GPs, doctors and other professionals in high-stress jobs. Working in today's pressured environment, you may feel like a frog in boiling water. Things have heated up so slowly that you might not have noticed the extra long days becoming the norm. You've got used to feeling constantly busy and often one crisis away from not coping. Let's face it, frogs only have two options: to stay in the pan and be boiled alive, or to hop out and leave. But you are not a frog, and that's where this podcast comes in. You can do more than just hop out or burn out. There are simple changes that you can make which will make a huge difference to your stress levels and help you enjoy life again. I'm your host, Dr Rachel Morris, GP, turned executive coach, speaker, specialist in workplace resilience and creator of the Shapes Toolkit training programme. In the podcast, I'll be chatting with friends, colleagues and experts, all who have an interesting take on this stuff, so that together we can take back control and thrive. If you want more resources, including CPD reflection forms for the podcast, then make sure you've signed up to the You Are Not a Frog Collective, and please share these podcasts with anyone who needs them. On with the episode. So it's brilliant to have with me on the podcast this week, Shani Langdon. Now, Shani's a clinical psychologist who specialises in mindfulness-based approaches. Shani, have I got that right?
Yes, that's right. I do a mixture of therapy work. And for most of my therapy work now, I'm using acceptance and commitment therapy, which is obviously what we're having a think about today together. And then I also teach mindfulness with my colleague Eleanor, who you know well, and who introduced us. And we do a mixture in the work that we do, running courses of the kind of more standard 8-week mindfulness courses, and we're now bringing in ACT to that as well. I should say that ACT is short for acceptance and commitment therapy, and that's what we generally would refer to it as. It's a bit less of a mouthful.
Yeah. Now I'm really interested in ACT, and that's one of the reasons I've asked you on the podcast, because I've sort of heard it mentioned in various guises over the last couple of years. And then one of my Red Whale colleagues, Lee David, who's a GP with special interest in mental health and CBT therapist, was asked for her sort of one top book of the year, and she recommended the book by Russ Harris, The Happiness Trap, which is all about acceptance commitment therapy. So I thought, well, if Lee's recommending it, I'll read it. And I read it and I thought, oh my word, this is so needed. It's so important. And actually it was really important for me. So I thought, well, if it's important for me, then it'll be important for some of my listeners. So let's just start off by exploring a little bit about what is ACT in the first place.
So it's a kind of, well, I was going to say therapeutic approach, but really it can help, as you say, all of us really, in all walks of life, and a lot of coaches use it as well as an approach. And it's mindfulness based, so there's a lot of mindfulness in there in terms of getting in touch with the present moment. That's one of the main kind of processes we work on. But the kind of leading part of it is values. That's kind of what it's all in the name of, in a way. So the mindfulness, although it's really important, it's kind of secondary to that. It's like we're using the mindfulness to be able to live a life that's full and meaningful. And for me, that values part is just so important, and that's what's really drawn me to this approach, and has felt like somehow the missing link, from the work that I was doing before therapeutically, to be starting to get to what really matters to people.
Is that because sort of traditional mindfulness can seem like a bit of a vacuum? It's just about noticing your thoughts, and actually you can just become a more effective psychopath by doing lots of mindfulness.
Yeah, we can pay attention in that kind of way. I mean, I think values is there in traditional mindfulness practice and approaches as well. So it's not that it's, not around, but I think it's kind of much more implicit, if that makes sense. I think we get to what matters to us through doing the practices. But it's just not such an explicit focus, and it's not something that we kind of sit and think, well, hang on, what does really matter to me? And that's what we start to do in ACT.
really drew me to ACT was this thing about emotions, because I have discovered about myself is that I don't sit very well with negative emotions, and I find them difficult. I've done a little bit of sort of self-exploration recently, found out that for those of you that know the Enneagram, I'm an Enneagram 7, which means I love ideas and I love to be enthusiastic and I love to be very positive and optimistic about stuff. But then when things are difficult, I find it very difficult to accept the difficult emotions, and I'll try and problem solve my way out of it, or I'll try and distract my way out of it. And for me, reading that book about being mindful about your feelings, and then it's okay to feel those feelings, and then but some ways to not let them overwhelm you and sit with you, was really, really helpful.
Yeah, and that's one of the main kind of premises, I guess, of ACT, is that, a part of being human, if we're going to live a life that matters to us, is having the difficult and uncomfortable emotions as well as the joyful, wonderful ones. And that it's really normal not to want the uncomfortable ones as well. I really don't think you're alone in that. And it's our mind's mechanism of trying to keep us safe, of trying to prevent us from pain, that it tries to get us to avoid those feelings, because our minds kind of do the same with emotional pain as they do with danger and physical pain. And so it's not that our minds are doing anything wrong when they're trying to get us not to feel that kind of stuff, because who wants to? It's really difficult. And then we also know that when we do avoid those feelings, then that can kind of get us into an even stickier situation, and it can kind of stop us from being effective potentially, and from living the life that we really want to lead.
So how can ACT help with that? How does it help us accept and work through and live with our feelings?
Well, through a mixture of different processes. So one really important one is diffusion, which is one of the main kind of techniques, and there are lots and lots of ways that we can practice diffusing. So the idea is that when you're really caught up in something, a really difficult feeling, that's what we call getting fused, when that's kind of all we can see, and it kind of gets in the way of us being present with people, connecting with others, and being effective, because it's kind of preoccupying us so much. And so in ACT, there are all these different techniques that we call diffusion techniques that just help us to kind of unhook from some of those difficult thoughts and feelings. And it's really important that we do that knowing that we're not trying to get rid of them. Again, it's so easy to kind of think, oh good, if I can unhook from them, then they won't be there anymore and I won't have to deal with them. And it's not about that. It's about kind of shifting our relationship with them so that they have less of an impact on us, and so that it's not those that are kind of driving our behaviours, what we do. So those diffusion techniques are one of the really important parts of ACT. There's also the kind of, as you say, the kind of acceptance part. And acceptance can be a really tricky word, I think, because there are so many associations with it, and and I think that we can sometimes mistake it for like resignation, or just kind of, oh, I'm just lying down and taking it then, and it's not about that. It's much more a kind of, those maps where it just has this little pinpoint saying you are here, and you kind of use that to work out where you're at and then where you want to get to. And that's what acceptance is much more about. It's just saying, this is what's here right now, this is where I am at. And then once you've kind of made space for that and kind of acknowledged that this is what's here, then we can kind of move forward. And it doesn't mean at all that we won't try to do something about a situation if we need to. And that's the kind of committed action part of ACT, where we're starting to do things in the service of our values, where we're starting to take steps towards living our values. But it's just the idea that, you know, the more we kind of fight with our feelings and our thoughts, the more it's a bit like, you know, it's quicksand, you know, the analogy of quicksand, and that, you know, the more we struggle, the kind of more we get sucked in by it. And it's like that with our emotions as well. The more we kind of fight with them, the more often meta emotions we get about them. You know, oh, why am I feeling anxious? I shouldn't be feeling anxious. And, you know, we get angry about feeling anxious, and then maybe feeling a bit ashamed about feeling angry about, you know, and it's all these layers on top. And so this idea of acceptance is just like, okay, let's just directly experience what's here, and then we can kind of go from there. I don't know if that makes sense.
It does. I think it's so important. I think as sort of doctors, healthcare professionals and other professionals in these sort of really high stress jobs, we are so used to thinking our way out of stuff. And I remember a couple of years ago, someone had done something that had really hacked me off. But I knew that the good thing to do would be just to leave it, to forgive them, to, you know, the more I sort of said to myself, I just need to leave it and not, the more cross I got about it. And in the end, I ended up having a complete meltdown with the vet. Well, I ended up having to have the conversation that I'd been saying to myself, no, I don't need to have it, it's fine, you know, because I was struggling against it, because I was saying I shouldn't be feeling this, I shouldn't be that, I shouldn't be that. So for me, I think ACTS would have really helped then in saying, actually, I am feeling this, and that's okay. Or even that if you take a step back to the diffusion bit, for me, I think that is really, really important. And I think that's, I guess, why mindfulness is so important, that you start to notice that you're thinking these things, but the diffusion is all about whether you decide to take notice of the thoughts or not. Yeah. So I can have the thoughts, but I don't need to take notice of it. And I was reading the book on it as I went skiing this year, and someone was really, okay, a bit of a theme here. I was getting a bit irritated.
Yeah.
And because I read the book, I know the book, it said, you know, you can say to yourself, if you want to start to try and diffuse something, you say to yourself, oh, I'm thinking this. Yeah. It starts to separate it. Or I'm having the thought that. And just by saying, I'm having the thought that such and such being a bit irritating, I could then go, so I'm just not going to bother. I'm just going to let that thought wander off. I'm not going to fuse with that. And it was the first time I really had realised that we aren't our thoughts, and we can choose whether to leave it or to think about it. But for me, that was really helpful. And how does that then go with acceptance? I think maybe, is it that if you can't get away from the thought, you then have to go to the acceptance, or is there a bit of both in each of it?
Well, I think it's both, because it's you know, it's partly just the way you've described it just then. Oh, there's that thought, you know, even in acknowledging it, it's kind of letting it be there, isn't it? It's, as you say, versus that other experience where you were like, oh, I shouldn't be feeling like this, or I shouldn't be thinking that, you know, that's when that kind of battle starts, isn't it, where we start kind of debating with ourselves and you know, telling ourselves we shouldn't be feeling something. So it's that first step, even just acknowledging it and saying, oh, I'm having the thought that's some level of acceptance, isn't it? Because we're saying it's here, this is what's here. And then, you know, often there's emotion that comes with it, that comes with thoughts. And so I guess the other area of allowing for that, letting that stuff be there, is it's kind of, well, in ACT we often call it making space for. So I do a making space practice with people quite often, which is just kind of sitting with it, and we often do physicalizing. So really coming into the body and just really noticing where in your body it shows up. And you can even start to imagine it as like an object. So, you know, if it was an object, what shape would it be? Would it have hard edges or soft ones? Would it be, you know, kind of rigid or soft and wobbly? Would it have a temperature? Would it have a colour? So really starting to explore with kind of curiosity. Quite often in mindfulness and ACT we think about the David Attenborough attitude. I don't know if you've heard of that before.
No, tell us about the David Attenborough attitude.
Well, so you know how David Attenborough, you know, whatever he comes across in his explorations, you know, he could have like a tarantula over here and a really soft little furry mouse over here, and you know, anything he comes across, he kind of brings that same curiosity and interest of gentleness and openness, really, to whatever it is. It doesn't matter what he finds, he brings that same kind of attitude. Does that make sense? I don't know if you can imagine, here is the little pygmy mouse.
I really feel a feeling of intense irritation with that other person.
And here is the irritation building. Can you kind of bring that curiosity? Okay, so here's the irritation, and where is it in my body? Where's it showing up for me? And often we'll feel tension or anxiety in our chest or in our stomach or around our throat. So can you really just explore in that kind of David Attenborough-esque way, what you're noticing in those different parts of your body, and just start to be curious about it, open up to it. And then, then we can also, if we want to, try out breathing into it a bit. So just kind of imagining our breath coming into and out of it. You can imagine it a bit like water flowing through it or around it. But it's just, and it's not to change it or to get rid of it. But it's just about letting it be there. And it's just a kind of, I suppose, a more tangible way to start practicing letting it being there, if we can kind of explore it in that kind of way. Does that make sense?
It does make sense. I mean, one thing that struck me about with the book when it's talking about emotions is that we're very quick to label things as positive and negative, aren't we? So happiness and love is positive and anger and sadness is negative. It's quite quick to say actually all these are spectrums of being a human being, and why shouldn't we feel sadness as much as we feel love, and that's okay?
Yeah. And I mean, so Steve Hayes, who's the founder of ACT, has this great phrase, we hurt where we care. And that's what it's all about, really, isn't it? Like, all of our different emotions are about things that mean something to us, and they're telling us something. They're kind of signals to us, aren't they, about something? So, anger is often some kind of injustice, or, someone maybe overstepping our boundary, or, something that needs some action taken. And so it's a kind of call to us, isn't it, to do something and to say that wasn't right, that wasn't okay with me. And the same with sadness, as you say, we're sad often if we lose someone we care about, or if it's often there's often loss in there, isn't there? And it's the flip side, really, of love and care. So that I think that's so important. And again, that's one of the really important premises of ACT, is about emotions all having a purpose. And then as you say, then you start to slightly lose this sense of kind of positive and negative, because it's like, well, they're all here for a reason. And then we can start to use them as well, once we've allowed them to be there and given them space. Is there something that any of these thoughts or feelings are telling us that we do need to take action about, or that we can just be really kind to ourselves about? So again, it's not about kind of getting rid of them or ignoring them, because they may have something to tell us.
So that's where the commitment stuff comes in the acceptance and commitment therapy, that we're then using them to make changes that are consistent with our values and to take action.
Yeah, exactly. And often those emotions will tell us something. If we can sit and listen to them, they'll tell us something about what does matter to us, which we can then kind of harness in some of these actions and ways that we start to live our lives.
And then how does ACT sort of suggest people then take action on things? Is there a sort of set way of doing it, or is it just really up to the individual?
Well, I guess the first step in a way is the getting in touch with the values, because we don't want to just be getting onto the doing, and with the mindfulness stuff, we're practicing being rather than doing. And it's this kind of different way of relating. We're so often, aren't we, in this kind of driven doing, getting somewhere mode. And so with the mindfulness, we're starting to kind of practice the being stuff. And then the getting in touch with the values is starting to really connect with, well, how do we want to act? How do we want to be in our lives what kind of friend, professional, partner, parent, whatever our roles, we've all got so many different roles, haven't we, different hats that we wear, and we can start to really look in all those different areas of our lives. Well, what kind of friend, partner, parent, professional do I want to be? What really matters to me in those areas? And it's then that we can start to think, okay, so what actions based on those values do I want to start taking? And there's a really kind of important distinction that's often made in ACT in terms of the difference between values and goals. And so values are like the direction of travel that we want to take. It's a bit like saying, okay, I'm going to go west. And any movement west is still going in that direction, isn't it? And I think that's so helpful when we start to think about what actions we want to take, because it doesn't have to be anything dramatic initially. We can just take one small step at a time. And then goals are kind of places that we might want to visit along the way. So if we're traveling west, we might get to Wales and then Ireland, and there might be a mountain we want to climb part way along. So those can be the goals, but they're a different thing. They're the things that we can kind of tick off and say, right, that's done. But it's how we go about doing those things that is what our values are about, and that is a work in progress.
Yes, I can see that. Someone might say, I can't have a goal to be a good mum, because that's a value. I want to be a compassionate mother, but a goal might be to do more activities with my children.
Exactly. And then we can start to say, well, okay, I want to be a compassionate, caring mum, who's playful. Okay, so what can I bring into my parenting to start to try some of that stuff? Are there little, I don't know, games or or just in the way that I'm listening to my child, how can I show them that I'm trying to bring this value to that interaction with them? So it's the how, it's the adverbs, it's the how we're doing the thing that is where the values are.
Yeah. So typically, how would you use this with the client? And if they were to come into a session with you and sit down and say, I'm experiencing this issue, what would you do, and how would you help them use all this?
Well, it would depend kind of where they're at. So with that, because there are all these kind of different processes, and there are kind of 6 processes that we kind of call the hexaflex in ACT, and we call it kind of dancing around the hexaflex, because it it just depends where the person is when they come in as to where you would start. And I suppose if someone's really struggling with anxiety or depression, and there are particular thoughts or stories that are going on for them that are just really getting in the way of their lives, then you may well start with the diffusion type stuff, because if that's just kind of the obstacle to doing anything, then they need to start to have some techniques that they can apply to start to unhook when those thoughts and feelings come in and are just getting in the way of life. But I guess if someone just was feeling a bit lost, if sometimes people come just saying, I feel like I've kind of lost direction in my life, I just don't know where I want to go. Maybe they've taken a career break, or some big thing in their life has shifted in some way. They may have moved to a different area, for example, and they're just feeling a bit kind of lost. Then the values stuff can be a really good place to start there, because you can then just start to think, well, look, what matters to you, and how can you just in small ways start to bring these values, this way of living into your life. And then it often seems to be that starting to really clarify that helps people to just start making small steps, and then it kind of builds from there, that they can kind of find some shape and meaning to the path that they want to go down. But then with all of this, all of the different processes kind of support each other, really, because then you know, when you start practicing the mindfulness, being able to be more present in the moment, then it's easier to do the diffusion, because you kind of catch yourself thinking those thoughts and those feelings coming up a bit sooner, so then you can start to apply the unhooking skills. And then, you know, it's often having the values as well that helps us in more, you know, in really difficult situations where we're really in it. You know, if we can really get in touch with our values and how we want to be, then that can kind of be the impetus to start unhooking, so that we can start making those. So in ACT, we often talk about away moves and towards moves. So the towards moves are where we're kind of unhooked and we're living life as we want to be living it, and the away moves are the you know, where we're not acting like the person we want to be because we've got really hooked in. So, you know, everything kind of helps everything else, but if you've got those values in place, then it's a way to kind of start to nudge ourselves towards the towards move path. So
I was going to ask you sort of how mindfulness sort of fits into all this. I guess you just sort of answered that question a bit, saying one of the ways mindfulness helps is because you then start to get trained and just notice what's going on notice what the thoughts are popping into your brain. Is there any other way that it can help?
Yeah, so grounding, and so in one of the practices that we talk about in ACT is dropping anchor. So, and you know, it can be just a really simple thing where you just really notice the sensations between the soles of your feet and the floor, and you know, your bottom on the chair, and you might want to just kind of put your fingertips together, so that you've just got that sense of contact and just of being a bit grounded, and yeah, dropping anchor. And then you can just kind of notice what that's like. And then, you know, you can also start to notice perhaps 3 things you can see around you, 3 things you can hear in the room. So it's quite a simple practice, but it's just a way to kind of connect and ground ourselves. And again, that can kind of help us as a first step to the diffusion, because if we can kind of get into our bodies in that way, then it can just help us to kind of shift out of our heads and out of that chatter. And then the mindfulness helps with the acceptance as well, because, you know, we're practicing all the time in mindfulness practices, just noticing what's here. As I say, we're kind of going into that being mode. And so, you know, all the time, whatever you're focusing on, when we're doing a mindfulness practice, there's always a focus. So whether it's our breath or our body or sounds or what we can see. And because we're starting to practice just that kind of non-judgmental awareness, and again, that kind of David Attenborough-esque attitude, we're just starting to watch what's here. We're not trying to change anything. We're not trying to get anywhere. And, you know, and I think often there are kind of misconceptions about mindfulness practice that we're meant to sit there and make our mind go blank, and that we should feel really calm by the time we've finished a practice. And it's not about that. All it is about practicing, noticing whatever's here. And, you know, if we've just had a really stressful or busy, difficult day, our mind is not going to just kind of, you know, blank and go clear. We're going to be sitting there watching. It's like a microcosm of what's going on for us. So we're going to be sitting watching our mind whirring. Mm-hmm. And it may settle as we practice, you know, if we bring our attention to the breath or to the soles of the feet or whatever, it may start to settle, and it may not. And that's, you know, that's not the point. The point is to just watch where we're at and to let that be there. And then to start noticing if there are layers of, you know, judgment and comment on that. And then when our mind drifts off, we go, oh, there you are, and we bring it back. And so all the time we're kind of cultivating that attitude of kind of non-judgmental awareness and allowing what's there to be there. So that then can really help with the kind of acceptance side of things, because we're kind of practicing that with more, I suppose, more neutral experiences. You know, it's kind of easier to say, oh, there's my breath going in and out, than it is to go, there's that really irritating thought. and it's in my body, you know. And that's why in the 8-week courses, then we start with the focus on the body, doing a body scan, and then noticing the breath, and it's only later on that we, you know, come to the sitting with the more difficult thoughts and feelings.
So how would someone who's, say, experienced a lot of stress, I'm thinking of someone at the end of a busy surgery, or someone running an apartment in a hospital, or a manager with a team that they've got to support, working virtually, in the moment, how can, you know, if they suddenly start to feel a bit overwhelmed with anxiety about the COVID situation, you know, what's going to happen to the economy, what's going to happen to my job, what's going to happen to how we do things around here, are there any sort of quick things that they can take from ACT that they can do right there and then to help?
So I think the first one is that grounding, just that kind of, you know, okay, well, look, here I am, let me feel the contact between my feet and the floor, my body in the chair if they're on the chair, or, you know, or just noticing if they're walking, maybe just tuning into the sensations of the movements as the arms swing, or, you know, just really getting into the body. And then, you know, some of that diffusion stuff can be really helpful. I'm having the thought that, you know, the economy is going to be awful, I should have done this, you know, when I saw that patient, it's all going to go horribly wrong, you know, just I'm having the thought that, I'm noticing I'm having the thought that. So just to be acknowledging that.
And can I just check with that, even if those thoughts are true, that's fine still to let them go? Okay, it's not about deciding if a thought is true, so I decide if I have to use a thought whether it's true or not. It's just, is this helpful to me at the moment to be thinking this? And
you know, the kind of helpful thing is, you know, that's kind of, I guess, how we decide what we do with it. But at the moment, at that moment, you know, it's just, oh, it's here, you know, whether or not it's helpful, whether or not it's true, it's just like, there it is, you know, just to even wake ourselves up to that being in our minds, because I think, you know, so often we're just in these trains of thought and we just don't even realise it. I don't know if that's familiar to you. It certainly is to me. You know, I can just be down a whole path, you know, and have decided what's happening for the next 10 years, and then I suddenly am like, I've just kind of missed a small portion of my life because I've just gone down that path. And so that first step is just acknowledging I'm having the thought that, and just noticing that kind of whole train has appeared. But yeah, with ACT, we are less interested in a way with whether the thought is true or false. It's the kind of function of it and how we relate to it. And I don't say that at all in a dismissive way or not to validate thoughts, because, you know, as I've said, that there are often kind of important messages in them, and you know, they can be about really valid, important things, and as you say, especially in these really difficult times. So it's not at all to say that they don't matter, but it's just, you know, in terms of how we respond to them, can we kind of hold them a bit more lightly, so that they just don't have such a huge impact on us, and then we can kind of start to, you know, notice where in our body they show up, if there's emotion to do with them. And then when we've allowed space for that, that's when we can start to think, well, okay, well, what can I do? You know, what is in my control here? You know, whether the economy collapses, how the virus spreads globally, you know, those kinds of things we can't control those. So can we come to what we can do? And we can't control our emotions or our thoughts, you know, none of that is stuff we can control. But what we can do is we can control what we do and how we do it, you know, in that kind of smaller way in our everyday lives.
So if someone was really struggling with some of these emotions, what would your 3 top tips be for them?
I'm just thinking of this kind of face COVID stuff that Russ Harris talks about, that people might find helpful to look at. But so his first steps are focus on what's in your control.
Yeah.
Acknowledge the thoughts and feelings. and I would kind of put that with then come into your body. So it's that kind of acknowledging, allowing what's here to be here. And then, I'm getting to more than 3 here.
That's okay. No, tell us about the face COVID, because I think that's important and useful stuff.
Yeah. So he's come up with this acronym. Russ Harris, who's one of the big kind of trainers and authors in ACT, he's come up with an acronym that just gives us some things that we can practically do in terms of all of these different aspects of ACT in relation to the COVID crisis. And so his FACE acronym is focus on what's in your control, acknowledge thoughts and feelings, come back into your body, and engage in what you're doing. So this is this grounding and getting present stuff. And then his COVID part of the acronym is committed action. So that's what we've been talking about, and this is part of the what's doing in your control. It's, you know, in your day-to-day life, how can you make a difference? You know, and maybe it's the way that you talk to your patients, or the time that you give to someone who's just really struggling in some way. You know, it's those things that might seem small compared to all these massive things in the crisis, but actually can make a huge difference to people's lives. And then there's open up is the O, which is this making space for all these feelings. The values is, you know, what sort of person you want to be in the face of this crisis. If you look back in 20 years' time, how would you want to say that you showed up at this time? And then identify resources, which is resources for help, assistance, support, advice. And I guess, you know, in the case of GPs working with all this, I guess that's partly going to be resources available as well, which, you know, obviously isn't as many as we would want and are needed. But, you know, it's harnessing the resources that are there, and I guess colleagues and support.
What have you got? What's in your control? What have you got to work with?
Exactly. What can you draw on? And you know, in your personal life, what can you draw on? And then there's disinfect and distance, which is, you know, obviously what everyone is trying to do.
Yeah. I think that's really helpful. I love that question, you know, after the, you know, in 20 years time when all this has passed, and it will pass eventually. You look back at, you know, imagine you're looking back and think to yourself, you know, when I'm looking back, how did I show up? How did I show up during the COVID crisis? Because that's so important. It's so important to ourselves, but to our families, to our friends, and to our patients, and to our work colleagues, and to our staff, all those sorts of things. And you know, that's why I love ACT, because it's about identifying your thoughts and feelings and accepting that they're there and you can't necessarily change them, but you can decide which to take notice of. And then you commit to what you're going to do to make a difference and to change to what's in your control. So important. Shani, thank you. That has been really, really helpful. If we'll put the link. I'll put the link to the face COVID stuff in the show notes. If people wanted to find out more about ACT, what would you suggest that they did?
Russ Harris's resources are great. So his book, as you mentioned, The Happiness Trap, and there's also an app for that, which there's a discount code so that you can get that for free for the next few months, I think until the end of June that's valid. And then his website, and there's also more general, I think it's called contextualscience.org, which is I think it's an American website, but that's got a lot of information about ACT. So yeah, those are kind of good places to start, just to find out more about it all.
Great. And if people wanted to contact you, how do they go about doing that?
I think we'll put our website, mine and Eleanor's website, in the show notes. So that's www.beinghumantogether.co.uk. And I think my LinkedIn profile is that there as well. And then, because that's got the kind of details of the private practice I work with as well.
Great, Shani. Thank you very much. We'll do that. And This is good timing because the machines are back. They're building a cycle path outside the front of my house, which is a nightmare on podcast day.
I'll just make space for that, you know.
I have to make space for the diggers. Yeah, absolutely. But that's been really helpful, and I think it'd be really great for some of our listeners. So thank you so much for spending this time to speak with us, and hopefully speak again soon.
Yeah, really good to talk to you, Rachel.
Thanks, Shani. Bye.
Thanks for listening. If you've enjoyed this episode, then please share it with your friends and colleagues. Please subscribe to my You Are Not a Frog email list and subscribe to the podcast. And if you have enjoyed it, then please leave me a rating wherever you listen to your podcasts. So keep well, everyone. You're doing a great job. You got this.